Hello, my name is Patrick Glenn and I'm a physical therapist with Orthopedics Rhode Island. And if you're like a lot of my patients, you have either in the past or are currently experiencing some type of shoulder pain. Your shoulder pain might be related to a specific diagnosis, but more than likely what's going on, regardless of your diagnosis, is dysfunction in your rotator cuff musculature. The rotator cuff is a group of 4 muscles that attach to your scapula and to your shoulder that all must work together to create smooth, pain-free motion in the shoulder. These 4 muscles are relatively small, and it's easy for them to become weak and dysfunctional, which will keep them from doing their job properly. And what is their job? Their job is to work together as a unit to keep your ball of your shoulder centered in the socket so that you can move your arm in all different positions without the ball hitting structures that it should not be hitting and causing pain. It's kind of like driving your car in the middle of a smooth road where there are no bumps or any other obstacles to keep your car operating properly, versus driving your car in the breakdown lane where it has the chance of hitting the guardrail or hitting a pothole that will cause a poor ride. Your shoulder's the same way. Your ball wants to move perfectly in the socket without bouncing off to the side, hitting other structures, causing pain. Your rotator cuff is the steering mechanism that keeps your ball centered in the socket. And regardless of your specific diagnosis, there are some very fundamental and simple exercises that you can start to do to help reduce pain and to begin to improve your range of motion and the strength of your rotator cuff muscles. So what we'll do in the following segments are begin to introduce you to some of these exercises and progress them from more simple fundamental exercises to more advanced exercises for strengthening. As with any exercise, if you feel pain or significant discomfort, please discontinue the exercise and consult your physician or a physical therapist for further help. If you're in a lot of pain and are having trouble getting your shoulder comfortable, begin with these simple exercises to help reduce the pain and start the process of improving your range of motion. So the first thing you want to do is stretch your neck out by doing cervical rotations side to side. You want to do 5 to each side, holding each one for a count of 10. And you would do 5 repetitions of those to each side. The next exercise you want to do is a pendulum exercise. And for that exercise, you just let your arm hang freely from your body without any tension, and then you begin to swing it nice and easy in a back and forth motion, letting momentum do all the work. You would want to do about 20 to 30 repetitions of these, side to side, and then you would do circles, 20 to 30 of them in each direction, a counterclockwise and a clockwise motion. And it's important that these motions are pain-free and that you're going in a circumference that doesn't cause pain. They could be small motions, or they can be larger, just as long as they don't cause pain. The next stretch you would want to do for your neck is a lateral side bend. So just tilting your head to one side, feeling a stretch, holding it for a slow count of 10, returning to neutral, and then doing it to the other side, feeling a stretch on this side of your neck, holding it for a count of 10, and doing back and forth 5 times in each direction.